have here are Escherichia coli enterohemolytic and Escherichia coli enteropenetrating or enteroadhesive. Is it clear? Now, the next one, you have Campylobacter jejuni. For C, for Campylobacter jejuni. Campylobacter jejuni. Is it clear? Campylobacter jejuni. And Y is for Yersinia. It is not Yersinia pestis because Yersinia pestis result to plague. It is instead Yersinia enterolytica. And this Yersinia enterolytica has a peculiar presentation like an acute appendicitis. Is it clear? This is a best differential for acute appendicitis. Is it clear? When you have a patient that has right iliac fossa pain, which is relieving when the patient is defecating. Is it clear? It is not right. It's not acute appendicitis, but it's inside Yersinia enterolytica. Is it clear? And that sign where you have an abdominal pain that relieves when you are defecating is called the care sign. Is it clear? Care sign. So those are the different elements that you need to evaluate. Basically, now the other causes, you have the protozoan causes of the diarrhea, and I've also told you that I've also forgot to tell you that what generally the physics in the case of inflammatory diarrhea, there are different characteristics of physics of the different diarrheas. Is it clear? Let's finish first with the protozoan. The protozoan that can cause inflammatory diarrhea, we have Entamoeba histolytica. Is it clear? So Entamoeba histolytica and also Entamoeba parahistolytica. Is it clear? And also among the bacteria that can cause also inflammatory diarrhea, we have Vibrio parahemolyticus. Is it clear? So those are it's still gotten from the seafood, just like Vibrio cholerae, but it's instead result to inflammatory diarrhea. Now, in the presentation of the diarrhea, when you have patients, you need to know that the characteristic of the diarrhea is very important. Is it clear? The characteristic of the diarrhea is very important. Generally, when you have an osmotic diarrhea, what are the peculiar characteristics of osmotic diarrhea? Osmotic diarrhea is much more of formed stools. You have formed stools. Is it clear? When you have osmotic diarrhea, you have formed stools. Is it clear? Just that it's going to be soft. You have formed stools, but they are soft. And then the next characteristic is that you may have also food particles. Is it clear? Particularly in cases of cellulose-induced diarrhea, where you don't digest cellulose. You need to know that there are mutualistic bacteria inside the rumen of the herbivores, which can help them to digest cellulose. So we have formed stools, and you have food particles present in the stool. So if you have those two characteristics, when you see the physics, you see that the physics is formed and the physics has food particles. It's much more an osmotic diarrhea on the physical exam, on their history, or also on the physical examination. Now, the next element is the case where you have secretory diarrhea. So how is going to be secretory diarrhea? As I've told you, it's going to be watery. Secretory diarrhea is going to be watery, and it is just like a peculiar characteristic of rice water stools. Is it clear? The diarrhea is coming out as if there is water with a boom sound. Are you getting? So that is when you go to defecate, the water is called, the pressure of the diarrhea is just coming with excessive pressure. It is coming out with a boom sound. When you have that boom sound, you know that it is a secretory diarrhea. And the typical presentation is a rice water stool. Is it clear? It is like rice water. When you put rice in water, that is how the diarrhea is going to represent. And I've already told you the microorganism involved in that. Now, after secretory diarrhea, we have inflammatory diarrhea. Is it clear? In cases of inflammatory diarrhea, it's going to generally present with, you can present with one, blood. Is it clear? You can present with blood, macroscopic blood present in it. Is it clear? It is generally mucoid. When you have diarrhea or the stools which are mucoid, you know that it is mostly inflammatory diarrhea. If the stools are mucoid, it is inflammatory diarrhea. And now the other elements is that it is associated with other symptoms. Is it clear? And those other symptoms may be fever, maybe abdominal pain, fever. When you have fever, abdominal pain. Is it clear? When you have fever, you have abdominal pain. The abdominal pain may relieve when defecating or may not relieve when defecating. If you have abdominal pain that relieve when defecating, is much more of a colitis. But when you have abdominal pain that does not relieve when defecating, it's much more of an enteritis. And when you're treated also with vomiting, it's much more of a gastritis. Is it clear? So those are the different elements. Now, the next symptom that can also be associated, we have a tenesmus. Is it clear? It is associated with inflammatory diarrhea, particularly for the case of entamoeba histolytica, because entamoeba histolytica can also affect at the level of the rectum. Is it clear? So when you have inflammation of the rectum, you have sensation of defecation, but when you go to defecate, you have no feces coming out. That is a part peculiar for entamoeba histolytica and still show that you have an inflammatory diarrhea. Is it clear? So the diarrhea that has blood in it is particularly for bacterial dysentery. When you have blood inside the diarrhea, it's called dysentery. It's particular for bacterial dysentery in the case of a Shigella. Is it clear? When you have Shigella, it can be bacterial dysentery. Or when you have entamoeba histolytica, it can also tell you it is an amoebic dysentery. There is also blood in stools, but the blood in stools in Shigella is much more than the blood in stools in entamoeba histolytica. We have also Escherichia coli, which can result to blood in stools. Is it clear? And you have that particular Escherichia coli, it's either Escherichia coli hemolyticus or you have Escherichia coli enteroadhesive or penetrating. Is it clear? So those are the different elements that you have to visualize when you have diarrhea. Now, we continue with the next point of focus. After visualizing the diarrhea, the next point of focus we continue with